people think acne is just a teenage problem that goes away once we grown up. But the truth is, some people continues to have acne breakouts even in their 20s or even 30s. So why does this all happen? Acne isn't just a skin problem. The deepest causes is hormonal imbalance combined with chronic inflammations. We classify acne into different grades because the treatment's approach and urgencies vary depending on the severities. Acne is categorized from grades 0 to grade 5. Different grades of acne require completely different types of treatment strategies. At Anahu Clinics, we accompany you through every step of the treatments, helping your skin return to its healthiest and the most confident state. Many people think acne is just a teenage problem that goes away once we grown up. But the truth is, some people continues to have acne breakouts even in their 20s or even 30s. So why does this all happen? Acne isn't just a skin problem. The deepest causes is hormonal imbalance combined with chronic inflammations. We classify acne into different grades because the treatment's approach and urgencies vary depending on the severities. Acne is categorized from grades 0 to grade 5. Different grades of acne require completely different types of treatment strategies. At Anahu Clinics, we accompany you through every step of the treatments, helping your skin return to its healthiest and the most confident state. Hello everyone, welcome to Anahu channel. This is a space dedicated to sharing knowledge about health and medical aesthetics. I'm Dr. Ian. Today we are going to talk about skin issues that many people faces, acne, and why it often seems to come back no matter what you have tried. We'll cover questions like, do you always need medications for acne? Why do some people still get breakout of acne after puberty? How are terms like oil imbalance, hormonal fluctuations, and chronic inflammations really connected to acne? How should different severities be treated to avoid scars and recurrence? Tonight, I'll explain everything in a simple, easy to understand way, connecting the science with practical skin preps. So let's get started. Before we start, a little giveaway for you. To reward our most active audience, we have prepared a complete essentials kit to share with you. If you have any questions about acne care, about acne, don't be shy. Drop them in the comment box below. And at the end of the live streams, we'll select 5 lucky viewers to receive this special gift. So what's inside this kit? First, we have NNM for you, 5 packs to boost vitalities and support cellular health. Second, there's a collagen C40, 4 packs inside to enhance skin elasticity and radiance from within. Third, we have Plant Pro Plus, 3 packs. It's a supplement for your daily nutrients needs and for your gut health. These kits help you to care for your bodies and skins from inside out, so you will look great, more radiance, and stay at your best. The winners will be announced tomorrow at Anna Hu Channel's Facebook page, so make sure you like us, follow us, and you won't want to miss it. Where do you most often get acne? Whether it's the forehead, nose, chin, or cheek? Type your answers in the comment box down below. I will explain on how the causes can differ depending on where breakouts appear. First, let us watch a short video to quickly understand what is acne. Many people think acne is just a teenage problem that goes away once we grown up. But the truth is, some people continue to have acne breakouts even in their 20s or even 30s. So why does this all happen? Do you need medications to fix it? And most importantly, is there a way to make this acne goes away for good? First of all, acne doesn't happen because your skin is dirty. It happens because your skin is in an inflamed state. Think of it this way. The oil glands under your skin are in a state of chronic inflammations. When your skin produces too much of oil, it mixes with the dead skin cells from the skin and clog up the pores. Bacteria inside the pores starts to multiply, leading to redness, swellings, and inflammations. Acne is actually closely related to inflammations in your body. When your body is in a state of chronic inflammations, your immune systems become more reactive and your skin is more prone to swollen pimples. Hormonal fluctuations are another major causes. During puberty, hormonal changes can stimulate the oil glands, making acne more likely to appear. Hormones act like an accelerator. When androgen levels are high, your oil glands produces more sebum, or we call it oil. Acne isn't just a skin problem. The deepest causes is hormonal imbalance combined with chronic inflammations. To improve your skin, you need to care for it both inside and out. Get enough rest, eat well, manage stress properly, and when needed, consult your doctors. Remember, don't lose confidence just because of temporary breakouts. Your skin deserves to be treated with gentleness and care. Welcome back. From the video, we saw what happened microscopically in the acne-prone skins. The pores get clogged with oil and the dead cells from our skins. Bacteria multiplies inside and the surrounding tissues becomes inflamed. To put it simple, acne is a chronic inflammation of hair follicles and sebaceous gland. What we call it is an oil gland. So, is oil-water imbalance the main causes? A more accurate way to put it is an overactive sebum productions of oil productions, a compromised skin barrier, and a disrupted skin cell turnover are the root causes. Dehydrated skin is more vulnerable, which in turn can trigger more oil productions, making the skin look oily and yet dry. Often this is linked with chronic inflammations and hormonal cycles. We also mentioned that acne in different areas have different causes, often related to your body or related to your lifestyles. For example, forehead acne, often related to the hair products that you use, causing oily hair when you sweat with frictions with the helmets or caps, stress or lack of sleep. Avoid oily hair products touching your forehead. Wash them off the skins more regularly, manage stress, and get adequate quality of sleep is very important. For those patients that have nose acne, they are usually linked to excess oils or clogged pores. Keeping these areas clean and avoid overly greasy food is very important. Cheek acne can be caused by pollution, leftover makeup, mask, or dirty phone or pillowcases. If breakouts appear repeatedly on one side of your face, check if you're always using that side to talk on the phone or you sleep more on that particular side. For chin and jawline acne, often links to hormonal fluctuations, menstrual cycles, or endocrine imbalance. Women may notice painful, larger pimples of acne in this area before or after their periods. For back and chest acne, often caused by sweat not being washed off promptly, tight or non-breathable clothing, and hot and humid environments that clog pores normally give rise to acne in this particular area. Why do some people experiencing recurring acne? How is teenage acne different from adult acne? Teenage acne is mainly driven by sudden hormonal surge, increased sebum productions, clogged pores, and finally inflammations. However, for adult acne, in addition to the hormone changes in the body, often links to chronic stress, poor sleep, high sugars, dairy-heavy diets, environmental irritants, and low-grade chronic inflammations. For women, recurrent chin and perioral acne often appears around menstrual cycles or during periods of stress. Irregular periods, excess hair growth, or overweight changes may indicate an endocrine imbalance that needs evaluations or investigations. Can acne be completely cured? A more accurate way is to think about it is long-term management. Acne-prone skin is like an overactive sebaceous gland or oil glands plus sensitive pores. If lifestyles, diet, or stress triggers occur, breakouts happens and breakouts can return. Our approach: first, cool down the inflammations. Second, repair the skin barrier. Third, regulate the sebums and skin cell turnover. Fourth, develop habits to prevent the recurrence. Even if you stop treatments and returns to old habits, breakouts may come back, which is why long-term care is the key. Next, let's watch a short video explaining how acne severities is graded and which type are the most prone to scarrings. Many people think acne is just a teenage problem that goes away once we grown up. But the truth is, some people continue to have acne breakouts even in their 20s or even 30s. So why does this all happen? Do you need medications to fix it? And most importantly, is there a way to make this acne goes away for good? Acne isn't just a skin problem. The deepest causes is hormonal imbalance combined with chronic inflammations. We classified acne into different grades because the treatment's approach and urgencies vary depending on the severities. Acne is categorized from grades 0 to grade 5. In grade 0, we can notice no acne at all and the skin is stable. Grade 1 to 2 is actually categorized as mild acne. Usually, you can see a few blackheads or whiteheads, or occasionally you can see small pimples pop up here and there, and they are not very red or swollen. Most people can control this level with gentle skincare and regular lifestyle changes. For grade 3 and 4, we categorize these grades into moderate acne. At this stage, acne becomes more noticeable with redness, swelling, and sometimes pustule, what we call the lesions with pus inside. If left untreated, inflammations can worsen and there's an increasing risk of pigmentations happens. For the last grade, grade 5 is a grading for severe acne, where in this stage is more challenging to treat and there are usually more cysts and nodules we can observe over the patient's skin. And the skin is very prone to get scarrings, including deep indented scars. So why do doctors always assess the severities before deciding on treatments? Different grades of acne require completely different type of treatment strategies. I give you examples. If you have mild acne, we may suggest lifestyle adjustment, choosing the right cleanser, and choosing the right skincare routines. Additionally, if we discover that your acne is related to hormonal imbalance, chronic inflammations, or even endocrine disorder, we will address these underlying factors in the treatments, not just prescribing topicals, creams, or Corate a day. Effective acne management means finding a comprehensive plan that suits you and maintaining healthy long-term habits. If acne is troubling you, don't hesitate to seek for help from a qualified doctor who can guide you towards the most suitable treatments for you. Welcome back. Let's review how acne's severity is classified or graded, and which type are most prone to develop scarring. According to the commonly used US grading, there are gradings from 0 to 5. Grade 0, almost no lesions. Grade 1 to 2, we grade it as a mild acne. Mostly you can see comedons, occasional small red bumps on your face. For grade 3, it's a moderate acne, where you can observe there's a redness, swelling, numerous comedons, or you call it white or blackhead, papules, pustule, and it involves more than half the face. For grading of 4, it's a severe types of acne, which entire face is involved. You can observe there's numerous papules, pustules, and a few nodules or cysts over your face. For grade 5, grade as a very severe acne, where you can observe there's a lot of nodules, cysts, and painful lesions, and it involves a very wide area of your face, including sometimes being involved over the neck also. In general, grade 4 and 5 are the most likely to leave pitted scars and pigmentations on your face. Grade 3, for moderate acne, it can scar if repeatedly squeezed or left untreated. Why do doctors grade the acne? Because treatments varies based on the severities of the acne itself and the skin type. The strength and the combinations of treatments need to be precise to be both effective and safe for the patients. Acne usually starts with a small comedons, or what we call it whitehead or blackhead. The progressions is from micro comedons, pores get clogged with oil and dead skin cells from our skin. At the second stage, which is the comedon stage, the whitehead or the blackheads appear. For stage number 3 is the inflammatory stage, where comedons get infected by the bacteria, which will cause redness, swelling, and pustule. The next and the final stage is where nodules and the cyst starts to develop. We call it a nodule or cyst stage. Severe inflammation happens in this particular stage, where you can observe hard lumps, and these lesions are more prone to scarrings and hyperpigmentations, or we call it the marks left behind on the skins after the acne breakout. Next, we go to the healing stage. Lesions subsequently subsides but may leave marks or scars. So, treatments should start at the comedon stage, which is the early stage, to prevent progressions to inflamed acne. Now, back to the audience questions. For those who want to win our complete essential kits, keep asking questions and interacting with me. The kits include NNM 5 packs, Collagen C Forte 4 packs, and Plant Pro Plus 3 packs in that particular kit. We'll announce the 5 lucky winners on our Anahu channel's Facebook page tomorrow, so don't forget to follow us there. There's first questions from our audience here. Can acne goes away on its own? Should we just leave it alone? Well, mild comedons, or we call it whiteheads or blackheads, sometimes able to resolve naturally without you doing anything. But inflamed acne, if left untreated, can easily lead to hyperpigmentations, or you call it marks, or even have a pitted scars. Instead of waiting for it to go away, it's better to control inflammations early to prevent the lasting mark. Question number 2. Acne broke out after using a new product. Is it an allergic reaction or is a purging? If the products contain AHA, BHA or retinoids that accelerate cells turnover for the first to third weeks may push hidden comedons to the surface with mild peeling. This is a controlled purging response. If you see wide spreads of redness, swelling, burning, or irritations that you experience on your face, it's more likely a reactions or allergic reactions that happen. You must reduce the frequency of the products that you use on your face, or you need to stop and repair the skin barrier. Question number 3. Does regular professionals' facial extractions prevent acne? Moderate professionals' extractions can help to reduce the clogging inside the pores, but over extractions spreads inflammations and can worsen pigmentations. Inflamed papules or cysts should always be treated by a professional's doctor. The next question is tea trees effective? Well, it can help early small red pimples, but use properly diluted, verified products and patch test first before you use it on the whole face. Avoid this during pregnancies or if you have very sensitive skins. Okay, here we have questions from the audience from Linda Tan. Does one need to take hormones from your clinics when one encounters pimples? If yes, would this be long or short-term consuming? Okay, well, first of all, to answer these questions, we don't take hormones if you have pimples itself. It's not like you take hormones when you see pimples of your face, then you start away straight. You take with you start consuming hormone. We need to make sure the pimples or the acne arises because of hormonal imbalance first. We need to come to the diagnosis. If your acne is because of hormonal imbalance, then yes, then we may start on hormonal therapies to regulate your hormone to help you with your active acne problems. And once we start on hormonal therapy, I would say it will be medium to long-term kinds of treatments. It will last from months, sometimes up to years. That is my answers to you, Linda. Okay, well, next we go to the next questions from SF Wong. Hi doctor, can tea tree oil cure pimples? All right, actually just now I did mention about tea tree oils in my videos, and also I shared just now. Actually, tea tree oil have the properties of anti-inflammatory. It can actually help in terms of to reducing the acne eruptions on your face. And this tea tree, but before you even use it over the whole face, I would suggest you to try on the spot test. Sometimes there are people that have irritants to all these oils or some acne products. Try it over areas around your neck. You apply a little bit, very thin layer. If there's no reactions, then okay, you can go and apply it over your face. If there's a reactions happens, then I would advise you not to use it. Or if you want to use it, then you need to space it out a little bit. The intervals need to be a bit longer. Yes, tea tree oils can help to improve and to reduce the appearance of the acne breakout. The next questions I get it here is, should I exfoliate if I have acne? Okay, this is very good questions. Actually, you can do exfoliations if you have acne, but I would suggest you to do it gently and carefully. Why is that? Why do I say so? Because if you exfoliate too much and using a wrong methods and you scrub it too harshly over your face, that can even create more problems, can create scarrings and can create PIH, and your skins can get very, very irritated and you break all the skin barrier. That can make your acne even worse. Gentle exfoliations with cleansers that contains what I mentioned just now, which have AHA, BHA, this can help to improve and to help you to get rid of the dead skins from clotting the pores, and help to exfoliate a little bit of the blackhead, I would say. Whiteheads is a bit difficult, but blackheads you can help with some exfoliations. Gentle is the answer. Do it gently. Next, are pimples patches helpful or harmful? I will assume the patches that you use is the hypocolloidal kind of patches that you apply on the pimples acne itself. Yes, it helps. One is to prevent you from touching and from pinching or picking the acne. Is very helpful. Then secondly is to prevent you are exposing the active acne to the surroundings, which is if you are in the working environments is very dusty, then it actually is very helpful. There are certain patches that also contains a little bit of the AHA and BHA that can even do a better job than the hypocolloidal kind of patches. To me, pimples patches, if you use correctly, then it helps. But if the pimples is like nodular and cystic kind of acne, then I don't think those type of patches will help anymore, because normally cystic and nodular acne is quite big, and that patches, I don't think that it can actually patch the whole acne lesions itself. The next question is genetic. Is acne genetic? All right, there is certain genetic linkage to it, but we cannot just blame genetic. There are other factors that contributing to acne itself, like I mentioned just now. The hormones, the stress, the diet that you are eating, then the hygienes that you are taking care of your skin hygiene. It play a role. So it's not just genetics per se. The next, what should I do if skin barrier is weakened, which leads to acne? It's very important. We need to take care of the skin barrier, especially if you're already using a very kind of harsh type of cleanser, or you scrub your face too much and you break the skin barrier. This will actually worsen the acne. What I would advise you need to make sure you recover your skin barrier first. Then only you treat the acne, or we can do it two at the same times. But to protect the skin barriers is very, very important. Otherwise the acne will take longer times to heal. Okay, I've answered so far a few questions already. Now let's watch a short videos about acne management, and don't forget to keep asking questions in the chat box below to stand a chance to win the essential kits that I just mentioned to you. Many people think acne is just a teenage problem that goes away once we grown up. But the truth is, some people continue to have acne breakouts even in their 20s or even 30s. So why does this all happen? Do you need medications to fix it? And most importantly, is there a way to make this acne goes away for good? Acne isn't just a skin problem. The deepest causes is hormonal imbalance combined with chronic inflammations. At Anahu Clinics, we believe that truly controlling acne isn't just about clearing all the breakouts. It's about tackling the root causes to reduce recurrence so your skin stays stable in long term. Our acne treatments process begins with a precise assessment of your skin conditions and acne grading. The doctors carefully evaluate the degrees of inflammations, the numbers of pimples, whether cystic or nodules are present, and whether your skin is prone to scarring. Understanding the root causes allow us to design a personalized treatment plan tailored just for you. To reduce inflammations, we first check whether specific dietary triggers might be causing the breakout. For some people who are sensitive to dairy may notice pimples flare up after consuming some dairy products such as milk, yogurt. If this applies to you, we'll discuss dietary adjustments and, if needed, recommend IgG food intolerant testings to identify the hidden triggers. Acne formations is closely linked to your internal health. We provide individualized nutritional assessment and, based on your needs, supplements with omega-3, vitamin D and other nutrients to support skin repair and boost your immune function. Lifestyle habits are also a key to managing acne. In Anahu clinics, we provide a practical lifestyle plan covering sleep optimizations, stress management, and dietary adjustments. All this designed to reduce the risk of recurrence from inside out. Our treatment approach is combining both oral medications and topical therapies. When needed, we integrate medical aesthetic procedures such as lasers, therapy, microneedlings, and scar reconstructions to not only improve active acne but also repair acne scars, leaving your skin smoother and more refined. At Anahu Clinics, we accompany you through every step of the treatments, helping your skin return to its healthiest and the most confident state. Welcome back. So how do we choose the right treatments? When I create a treatment plan, I will consider, is your skin prone to scarring? If yes, we act early to control inflammations. Second, are you suitable for oral medications? For example, do you plans for pregnancy right now? How's your liver functions right now? Whether you have liver failure, kidney failure, or drugs interactions, these come into considerations on which type of medications I have to use on you. Is acne related to hormonal fluctuations or menstrual cycles? Do you have chronic low-grade inflammations from lifestyle, for example from your sleep, stress, gut health, or diet? Treatment generally includes 3 parts: topical, oral medications, and medical or procedural therapy. Topical treatments, normally we give these treatments for mild to moderate acne. Examples of topical treatments such as retinoid, we often use at night. This is to clear the pores, normalize keratinizations, prevent comedons, but however, it may cause a little bit of mild redness or peeling initially. For those patients that are more sensitive, the reactions is a little bit more. Second types of topical medications are benzoyl peroxide. Normally we use these topical creams in the morning or on spot treatments, meaning to say over the lesions itself. These topical medication has a strong antibacterial property. It reduces resistance risk. The following we may use is the salicylic acid. Normally we can find it in cleanser or toner. It's used to dissolve the clogged pores, especially those oily clogged pores. Next is azelaic acid. It has an anti-inflammatory property, antibacterial property. It helps to fade the marks or pigmentations over the skin that left behind by the acne, and gentle for sensitive and dark prone skin. Next, we have topical antibiotics. It's used for short terms for acute inflammations and avoid long-term use to prevent resistance. Moisturizer. Don't be afraid to hydrate your skin. you need to choose a proper moisturizer which is not so rich in terms or not so oily for those patients who have oily skin, or you can choose those non-comedogenic products because these type of products help to repair the skin barrier. We need some things to repair the skin barrier so that our skins always stay healthy. Next, sunscreen is very important. Choose those are lightweight. This can help us to reduce the post-inflammatory hyperpigmentations. Oral treatments. Normally we cater oral treatments for moderate to severe or recurrence kind of acne. First type of oral treatments, we go for oral antibiotics. Normally we use it short terms. It can help to quickly reduce the inflammations in the body, to kill off the bacteria, and sometimes we use oral antibiotics combined with BPO to reduce the resistance. Oral isotretinoin. This is very useful to reduce oil productions over the face. It has anti-inflammatory effect and improve keratinizations for severe nodule cystic acne. But these medications require a very strict doctor's monitoring, especially for those patients to set up a family or plan to get pregnant. This is very important, and we need to run a series of blood tests or lab tests before we put the patients on this type of medications. Next, hormonal therapy, especially for females. Oral contraceptive pills or anti-androgens for jawlines or period-related acne breakouts. Nutritional support, such as like omega-3 and vitamin D, can help cool the inflammations if it is deficient in our body. It's used as a supportive but not a replacement for medications to treat acne breakout. Next, we go to the machine-based or procedure-based kinds of treatments for acne. There are varieties of it. First of all, there's chemical peels such as the AHA or BHA, help to accelerate the keratinizations and unclog the pores over our skins. Next, we can go for light or laser therapy, which has the antibacterials, anti-inflammatory, control sebums, and fade or lightens the pigmentations caused by acne. Okay, next, we can use some intralesional injection for the inflamed nodules or cysts. How this being performed is we inject small dosage of steroid into that particular lesions to make the lesions relieve faster, and these need to be done by the professionals, doctors. For scar face, microneedlings such as radiofrequency, laser resurfacing, fractional lasers with growth factors like PRP. This is very useful in terms of approach to the acne patients. How does a doctor decide what type of treatments, what to do when we see acne prone patients? First, we get a thorough medical history and we do acne gradings. We assess what are the triggers that causing acne happen in the patient's body, such as we go through her sleep program, diet, stress that patient is going through, what type of skincare patients using, what type of skincare habits that patients usually do, any patient taking any acne inducing ingredients, any medications that can cause acne breakout. We also do endocrine evaluations or investigations if needed. For example, if patients have irregular periods, sign of hyperandrogenism, we will do extra blood investigation to find this out. The goal is customized combination. Daily habits to prevent the recurrence. The 8+2 key habits, what I call it. First, adequate sleep. Chronic late night sleep raise stress hormones which stimulates oil productions and worsen inflammation. Second, balance sugar intake. Limit your refined sugar or high GI food such as candies, white bread, french fries. It's good to control oil productions and inflammation. Assess dairy and personal trigger food. Some people, especially those sensitive to skin milk, notice breakout after consumptions of that particular items. If you consistently break out, discuss dietary adjustment with your doctor. IgG food intolerance test can be a reference, but shouldn't be the only basis. Healthy fat in your diet, moderate omega-3 from fish, from nuts, help to cool down the inflammations in the body. Pay attention to total calories and omega-6:3 ratio. Stress management is also very important. Try to do meditations, exercise, deep breathing to reduce the internal fire or stress. Gentle cleansing your face, do it twice a day. Avoid too harsh soap or cleanser. Wash off the sweat promptly after you exercise or you work. Moisturize and repair. Choose non-comedogenic lotions or gel. A stable barrier reduces inflammations. Sunscreen and makeup removal. Lightweight sunscreen and gentle cleansings prevent pigmentations and clogged pores. Small lifestyle details that you need to take into consideration, such as wash your pillowcases and towel frequently. Avoid touching your face. Disinfect phones and headphones more regularly. For hair products, keep hair wax, hair creams off the face or bags and rinse with shampoo thoroughly. Cautions: don't squeeze or pick your acne because infections can happen. It's going to result in pigmentations and even worse, it can cause scarring. Avoid unverified acne remedies like which alcohol can use to reduce acne, toothpaste or some DIY treatments. Don't use orals or topicals antibiotics long-term without prescriptions or without advice of the doctors, because this can lead to resistance. Severe acne, pregnancy, or patients who plan for pregnancy or very sensitive skin, always see a doctor first before you start on any types of treatments for your acne. There's 3 key takeaways for you. First, acne is the result of chronic inflammation tendencies plus environmental trigger. Second, controlling acne requires a combinations approach, not a single magic solution. Early inflammation controls reduce the acne marks. Third, to prevent recurrence, master the basics of lifestyles skincare use. Now, feel free to leave your questions in the comment box down below. If you want a personalized skin analysis, type acne and our team will help you schedule an assessment. And don't forget today's giveaway. The complete essential kits will be yours. Hi, welcome back. Now I'm going to show you photos, before and after photos of my patients that I discussed a little bit on in terms of why these particular patients come and see me and what have been done and what is the treatment options and how the result of the patients right now. Okay, let's have a look at the photos on your screen right now. This particular patient, when he came over and see me, he is if I'm not wrong, age roughly about 40s. Then when he came and see me, he have a very bad acne breakout. I would grade it grade 4 to 5, severe to very severe, with you can see a lot of nodular cystic kinds of acne. Mainly happens a lot over his jawlines and also cover a little bit over his forehead. And not only there is active acne over his face, there's also, because of the acne itself, leave a lot of acne scarrings and acne marks, the red marks, the brown color, and also hyperpigmentation marks over his face. The first approach to treat these patients, because he's already in a grade 4 to 5, grading 4 to 5 and severe to very severe, and I started out the patients with antibiotics. And these antibiotics is a long course of antibiotics which runs from 1 month to up to about 3 to 4 months for these particular patients to control the infections and reduce the inflammations on this particular patient's face. Besides that, besides on oral antibiotics, I also put the patients on special skin care for the patients to use to help him to recover his skin barrier, and also the skin care to actually to get rid of the bacteria over the face and doing a proper cleansing. Besides that, I also advise patients he need to check on his diet to cut down all the diets that have high intakes in terms of sugar and high calorie intakes, or we call it high GI index food. If the patient's able to control on this part of his diet, you can actually see there's improvements in terms of the acne breakout. This is for all my patients. Actually, I advise them you have to really take care of your diet if you have acne breakout, because from my experience, diet play a very critical role in terms of why acne happen in every one of us. If you can take care of your diet, especially you cut down on those sugary stuff like candies or donuts or whatsoever high contents of sugar in that particular diet, cut down on your high carbs food, reduce fatty fried food, you can see there's improvement after you try to avoid this type of food. Within 2 weeks to 1 month, you can see the acne breakout become lesser, and you are able more easily you can control the acne. That's the concurrent treatment plans I offer to these particular patients. And with that, patients also come to the clinics to do the treatments, for example, like laser, to lighten the colors of the pigmentations because of the acne scars, and also the lasers able to reduce the redness from the scarring, and the laser itself can help to improve the unevenness over the patient's skin. The photos where you can see after we can control the active acne, and we put the patients on a series of laser treatments, the pigmentations become lightened, we can control the acne breakout, and this is the final result we get. This is after the treatments. This is not a one-day kind of improvement, but it takes time. What you see on the photos is these patients of mine, after 3 to 4 months, this is the result that you can get. Okay, next patients, I'll show you a lady. This one is a male patient. This is a female patient, where you can see initially, I will grade these patients' acne is roughly about 3 to 4, grading 3 to 4, meaning to moderate to severe. She came because she used certain products that make the acne worsen, and she was actually started on antibiotics by different doctors, and before she came and see me. When she came and see me, similar, I still continue the patients on the oral antibiotics treatments, but what I informed this particular patient, I asked her to cut down all the diets that contain high sugary, high fat diet, and also high carbs diet, because this type of food can cause inflammations in your body. Once you are able to cut down this type of food, you can see less inflammations, and with less inflammations, we are able to control the acne better. If you do not know regarding which type of food actually causing inflammation, these are the common ones, like what I mentioned, sugary kind of food, high in fatty acid or fatty food, high carbohydrates or high GI index food. And others, there are certain types of foods is very, very common that cause inflammation, such as like egg. If you would like to know more about this, we can help you to investigate. And how we investigate, we do a IgG food allergen test for us to detect what type of food your bodies are allergic to and which can cause inflammation in your body. With that, we can able to pinpoint which type of foods that actually cause inflammation in your body. If we can actually pointed it down, then it's easy for you to know which type of food, then you try to avoid that food. Then with that, you can cut down the inflammation in your body. All right. Now, I think there is a lot of questions coming in. I'll try to answer one by one. Okay, the first questions I get here is, can facials help to cure acne? All right, it's a very good question, and I think there's a lot of people that are asking this. Actually, facial cannot cure. I would say facials cannot cure acne, but it's a supportive treatments or procedures can actually help to control the acne. If you use it properly, you use proper cleansing, and you extract it, and to do it professionally by a doctors or a trained nurses, then to remove those pustular or those inflamed acne, this is very good. To remove it, then we can help to put in a more thorough kinds of treatments program, such as laser, or we initiate oral antibiotics to make the acne eruptions into remissions. Okay, well, we go to the next question. Can stress really cause breakout? Of course, the answer is yes. Then next, I would see, should I pop my pimples or leave them alone? I would advise you not to pop any of your pimples. Don't pick them. Just leave them alone. If you have to do it, you leave it, or you come to us, or you go to the professionals like doctors or dermatologists or aesthetic physicians. We can help you, and we can help you to remove or pop the pimples professionally, so that you won't leave a marks on your face and causing any scarring. The next question, sometimes I get acne on my nose. I'm not sure if it's due to hygiene or something else. Could I ask what might be causing it? Actually, acne's breakout over the nose is very, very common, because this is the area what we call it T-zone. T-zone is an area where there's a lot of oil productions happen in this particular area. And also you need to find out whether there is any frictions if you are wearing glasses, any frictions over this part, or you're wearing mask, then this is also a cause why acne always happens over these regions of your face. Because this region, there's a lot of oil productions. If you are using acne makeup, then it can also be the cause. You need to find out what's the cause. But anyway, once it's there, I will advise you to go to see doctors to sort it out, rather than you just pop it with your dirty hand, and that will make the acne worse. How long does acne treatments usually takes to show result? Okay, I will explain this in a way. If we are to start the treatments, for example, oral antibiotics. For oral antibiotics to start to see the improvement, normally is after, I would say, 6 weeks to 8 weeks later. It's not like you are giving it now, then tomorrow you can see the improvement. Not like we are giving paracetamol when you are headache, then after half an hour later you can see the result. There's no more pain. It doesn't work that way. There is a progressions to go about it. After treatments need to be started, about a month, I would say 6 weeks, like I mentioned just now, 6 weeks to 8 weeks later, then you can observe the improvements of the oral antibiotics result. The next one, I will get breakout whenever I consume fresh milk. Yes, of course, there is a study mentions there are certain people are very, how to say, is allergic or have a reactions to dairy products. There are some people after taking milk, yogurt can cause breakout over the face. It's very common nowadays. Even my own experience, I see quite a number of patients. Once they stop taking milk or dairy products, including yogurts, then they see they can control, I would say they can control the acne breakout better. The next question is it a must to consume antibiotics? Like I mentioned just now, not all acne we start the patients on oral antibiotics. Oral antibiotics only, for me, I will only start oral antibiotic to my patients will have a lot of pustular, cystic or nodular kinds of acne, meaning to say moderate to severe or very severe type of acne. Only I will start on oral antibiotics. Because if it's only mild, sometimes we do not need, you only need to change your skincare routines. You only need to take care of your diet, a bit of cleansing. With that changes actually can help to make what I call induce the remissions of the acne breakout. And it's very important for us to induce the remission, then prevent the relapse. This is the goal of acne treatments. I think that's about all the questions that are coming in right now. If you have more, then you can ask. If not, then we will call it a day tonight. And thank you everyone for joining me in our live sessions today. I really appreciate your time and all your questions. And remember to follow and subscribe us in Anna Hu channels. And take care, everyone. See you the next time. Thank you. Bye-bye.